guys, welcome back to the Q&A. So as a follow-up to last week's Q&A, today I'm going to get to the topic of lasers for scars. If you watched last week's Q&A, I overviewed all of the different types of scars, atrophic scars, hypertrophic scars. So if you're new here, make sure you check out that video so you know what I'm talking about here. But in today's video, I'm going to go over all of your questions about different types of lasers to treat different types of scars. And what the data is to show that it's helpful, and kind of just a little bit about the different procedures. Now, there are a few lasers that can be helpful for a variety of different scars, and for the laser to be effective and to have a successful outcome, there are a few factors that need to be taken into consideration. First of all is the classification of the type of scar. Is it a hypertrophic scar or a keloid, the subtypes that I discussed in last week's video. The color of the scar matters. Sometimes scars are more red and are more amenable to different types of lasers that target red coloration. Is the scar thick? Is the scar raised? It also depends on the background color of the individual skin. Whether the skin is darker or lighter will dictate the laser settings and the laser selected. And additionally, any prior treatments to the scar also have to be taken into consideration as well. Has the scar previously been injected with other medications to help flatten it out, and therefore the settings on the laser would subsequently be influenced. So long story short, the selection of the laser and the execution of the laser settings and treatment is very, 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 very precise and very particular, and should be done by somebody who has quite a bit of expertise in laser treatments, and this would be a dermatologist. A dermatologist who, oftentimes many dermatologists have these lasers in their practice. Some dermatologists do a lot of laser treatment for scars. You kind of have to feel out the dermatologists in your area, ask them about their experience with lasers for scar, and additionally ask them and find out from their credentials if they have any additional training in lasers. So for example, have they completed a special fellowship outside of just the standard dermatology training requirements? Have they completed a special type of fellowship where they got a lot of experience with lasers and laser treatment exclusively, or a skin surgery fellowship where they got a lot of laser treatments? Ask them about those kinds of things. That's the kind of information that you, as somebody seeking this treatment, want to know going in, is what the level of expertise of the individual performing the procedure is, to give you a good sense of what your outcomes are going to be. There are risks associated with lasers, as I went over in my lasers video. I have a video on, a variety of different lasers. They have potential to cause harm, not only to the skin. They can cause hyperpigmentation, burns, a variety of adverse outcomes if not used properly. But they also, if the person doesn't know what they're doing, they can really set you up for failure, particularly when you already have a scar. The last thing you want to do is make it worse. And as part of your consultation visit, they should go over with you kind of what to expect with the procedures, what the expectations are as far as your outcome. Ask if they can show you some before and after images of patients that they've treated before, specifically of scars, so you get a sense of what you might expect. This is something that you're likely going to have to invest in financially, so you want to make sure that your money is well spent and that you are in the best hands possible to minimize adverse effects. The other thing to take into consideration, depending on where you live, is this provider serving a population that is similar to you as far as skin? All right, providers may have more experience treating one skin tone than another, simply because that is the majority of the patients in their area coming to them. So that's kind of something to feel out, you know, and say, well, how many people with my skin type do you treat? Do you feel comfortable treating darker skin types? Can I see, if you are a darker skin type, can I see some before and after of your results, specifically in my skin tone? That is very important because different skin tones actually respond differently to different lasers and have different risks associated with them. So you want to get a sense of that as well. That's just a little bit of extra sophisticated knowledge that you as a consumer can understand going in, because as I said, you are going to be likely paying some money for this. Sometimes insurance will cover it, but it's something that you want to be aware of as far as making an informed decision about who you're going to and what their credentials are and if it's going to be a good fit for you. So, lasers for scars. You know, in last week's video, I went over the different types of scars. There's a hypertrophic scar, which is thickened, often occurs within a prior surgical site, like a surgical wound, for example, a C-section scar. These are thick scars. They tend to be red and stiff. They're the result of kind of overzealous collagen synthesis in the skin. And by definition, they stay within the area of skin injury. They don't extend outside of the boundaries of that prior wound. And they actually can regress with time. Similar to hypertrophic scars, but a little bit different, are keloids. Keloids are overzealous collagen deposition type scars that are very thick, and they actually can extend outside of the area of prior injury. So that's a subtle difference that I overviewed in that video. Additionally, they do not regress with time, so they are permanent. And both types of scars, just to reiterate, do not go away with creams. They are basically permanent, okay? So the laser therapy is something that's going to improve the look of them, but they can never really take the scar away completely, but they can offer substantial potential for improvement in the appearance of the scar. And then the other type of scar that I overviewed last week is the atrophic scar. Atrophic scars they're a variety of different types. They more often than not occur after, say, acne, for example. These are your ice pick scars, your rolling scars that I went over last week. And they are very amenable as well to a variety of different resurfacing lasers, which I will talk about today. All right, so as far as your hypertrophic scars and your keloid scars, what lasers can help the appearance of those? And that would have to be far and away a vascular laser or a pulse dye laser, specifically a laser around the wavelength of 585 nanometers. All right, what this wavelength of laser is helpful for in terms of improving keloids and hypertrophic scars is that these scars tend to be red, and these scars tend to be red, and the redness can improve substantially, and the scar can flatten as a result of the improvement in that redness. The scar itself can soften with time, flatten with time, and respond to lasers of the 585 nanometer wavelength, or the pulse dye lasers, also known as vascular lasers. It's important that you ask that when you go in for your consultation, because there are many brands of lasers out there with different jazzy names. And so if they're throwing the brand name of the laser at you, just kind of ask, like, is this a pulse dye laser? What type of wavelength is it? I'm just curious to know, is this something that's going to be appropriate for my scar, which happens to be red? And they will be able to go over that with you. But for hypertrophic scars and keloids, the laser that tends to work well for these is the 585 pulse dye laser. It can provide striking improvement in hypertrophic scars as far as pliability, reducing scar height. These types of scars can tingle, be itchy, kind of have some abnormal sensation as a result of that overzealous collagen kind of entrapping little nerves. And the pulse dye laser can actually improve some of these symptoms within the scar, so it can help with the symptoms of a scar as well. And overall, you know, there's a good body of evidence that consumer experience, patient outcomes are very satisfactory after this procedure for hypertrophic scars. Keloid scars, likewise, as well, can improve in both height, pliability. Unfortunately, keloid scars can sometimes be can sometimes hinder mobility. Okay, for example, if you have a thick keloid scar that has developed, you know, in the palm of your hand, God forbid, say you had an injury there to your hand, it can actually, you know, really impair the function of your hand. So keloid scars, as well as hypertrophic scars, like this kind of area or other areas, can really improve mobility of your hand, and that may be something that's obviously more important to you than even the cosmetic appearance of the scar. Okay, so, you know, taking a step back when you go in for that consultation, really think about what it is that you want to achieve with your scar treatment. Is it getting rid of the redness? Is it flattening it? Is it just improvement in symptoms? You know, that's helpful for not only the surgeon to know, but for you to just start really asking informed questions about what to expect as far as the outcome. In contrast to hypertrophic scars, however, keloid scars oftentimes will require the simultaneous injection of either a steroid medicine into the scar or a medicine called 5-fluorouracil into the scar. 5-fluorouracil is actually a type of chemotherapy, but it can be delivered to the scar collagen tissue exclusively without putting you through the risks of systemic chemotherapy. It actually can be delivered to a scar, and that, coupled with the pulse dye laser, can really get some pretty good improvement in various parameters of a keloid scar. The addition of injection of corticosteroids and 5-fluorouracil into a hypertrophic scar, however, is less impressive than it is with a keloid. A keloid kind of needs that little added boost. They tend to be more fickle, and they're much harder to treat than a hypertrophic scar. The success, however, is highly dependent on the individual performing the procedure. I'll just emphasize that again. For darker skin types, the intensity of the laser needs to be reduced. Also, depending on the location of the body where the hypertrophic scar or keloid is located, the intensity of the laser may also need to be modified accordingly. Some areas of the body are more sensitive, like the anterior chest, for example, where the skin is a lot thinner, kind of right over your sternum. That's not an uncommon area for people to develop hypertrophic scars and keloids, here in the midline upper chest, say you had something removed, as opposed to the back where the skin is much thicker and a lot tougher. Say you had a cyst removed from your back, the cyst surgical site was closed, and then you developed a hypertrophic scar. The surgeon could probably be a little bit more aggressive in terms of the laser settings at that location than they would say on the anterior chest. As far as the side effects from the pulse dye laser, probably, you have a little bit of redness, kind of a burning sensation. It feels like you got a sunburn as soon as it's going on, but that fades pretty quickly. And the most common side effect with the pulse dye laser, or the 585 nanometer wavelength laser, is a little bit of bruising after the procedure is to be expected. So plan accordingly. Discuss with the surgeon what you might expect as far as the post-operative bruising after the procedure, so you can kind of plan accordingly. With all laser treatments, however, do think of them as a type of surgery. They do, impact the skin barrier significantly, and as a result, during the time of healing or post-operatively, the skin is even more susceptible to sun damage, so you have to be very, very, very cautious in the sun. adhere to strict photo protection. It's definitely not a time to be laying out and going outside a lot without sun protection. Of course, you should never go out tanning, but you know, consider that if you're planning a vacation to a tropical area. May not be a good time to have a laser treatment like right before you go, because it's going to be even harder for you to comply with the sun protection that you need. This includes wearing a broad spectrum sunscreen, a broad brimmed hat, sun protective clothing, and keeping that scar out of the sun is imperative in that treatment site. Critical. It has to be sun protected. If it hits the sun, if the sun hits it, you know, it can cause hyperpigmentation and all sorts of problems that can be persistent. That's the last thing that you want. All right, but moving along to your atrophic scars. These are the scars that, you know, when you turn to the side, you can see a dent in the skin. That is permanent. Again, as I said last week, there is not a cream that's going to bring that back or bounce that back, really. But laser treatment for atrophic scars can be safely and effectively utilized to significantly improve the appearance of atrophic scars by using properly a high energy pulsed or scanned carbon dioxide laser, or another laser called the erbium YAG laser. These lasers emit actually in the wavelengths of infrared radiation, so they largely heat, and they actually target water in the skin. And whereas the pulse dye laser that I talked about before kind of targets blood vessels, but the carbon dioxide laser and the erbium YAG lasers, these can do something called selective photothermolysis, where when they are executed properly, they can actually target the deeper layers of the skin where that scar tissue is, help to kind of break it up, remodel it, and improve the appearance of the scar such that you have lessening of that divot appearance within the skin, and you get a more smooth, even surface. All right, these lasers, think of them as sort of vaporizing water within the skin to target different areas of the skin. So the intensity and the wavelength has to be very fine-tuned, and a skilled surgeon knows how to do that. All right, think of this as, you know, an analogy to this is an open heart surgery. That's a special type of surgeon who does that procedure. You know, think of this as a special type of skin surgery. It really is. I mean, it's not just point and shoot. You're not just pointing and shooting a laser. It is very, 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 very technical, all right, and really relies on the expertise of the person performing the procedure. And if not done properly, they can actually create deep dermal wounds if not done properly. The CO2 laser is actually much more efficient at targeting water as a chromophore, and therefore it tends to yield better results for atrophic scars than the erbium YAG laser. However, there is a slightly different erbium YAG laser called the hot or dual mode erbium YAG laser that some people can get comparable results with to the CO2 laser, almost equivalent for atrophic scars. But both of those can be used. However, they have quite a bit of downtime associated with them and several risks. So again, very important that you go to somebody who is well trained and really, you know, is well versed in potential complications. One risk, particularly on the face, that can occur with these types of lasers is if you've ever had cold sores around the mouth, you know, they're called fever blisters. These can erupt sometimes after you have this type of laser procedure, because it is basically creating an injury in the skin and a wound in the skin. Sometimes that leads to reactivation of the whole virus that causes these sores to pop up. And so that can happen. And because the skin is injured around the treated area, basically, I mean, it's basically a surgical wound. it can be very risky if you have an outbreak of a cold sore. So for them, more often than not, it's sort of standard of care for many surgeons to just go ahead, regardless of your history, to give you a little antiviral medicine just to be precautious. The antiviral medicine is very, very, very safe, very low risks of side effects. So for that medicine is often given. There's also a risk of a bacterial infection developing. There is also a risk of a little thrush developing within the area. Some surgeons will give a little bit of an antifungal medicine to combat that risk, but for the most part, it's actually not that common. And because this type of laser is creating a little wound and some inflammation and kind of changing the biology of your skin as the wound is healing, you can actually have a little flare of an acne-like rash. And then another possible complication of laser resurfacing or the CO2 or YAG laser is that you can actually develop amelia. People always in the comments always ask me, do creams cause amelia? No, but this actually can. Anything that damages the deeper layer of the skin, the dermis, can cause it to heal with these little cyst type lesions called amelia, and that can occur as a complication of resurfacing lasers for scars, for atrophic acne scars, or for other cosmetic, any cosmetic indication. Now, the resurfacing laser, the CO2 laser, the YAG lasers, these can be safely done in darker skin types, but post-inflammatory hyperpigmentation almost always occurs. It usually occurs within 3 to 4 weeks. So a lot of surgeons, don't feel like this is a good choice. Some do feel comfortable with it. Some will go ahead and start something like hydroquinone around the same time as the laser treatment is performed to mitigate that side effect, and they get really good results. So it's going to be, up to the expertise of the surgeon. That is why I think it is a good idea to ask them, what is your experience treating patients of my skin color for this type of scar that I have? Can I see some pictures? I realize that hyperpigmentation may be more of a problem in me. What do you think of that? And do you have any kind of plan to reduce the chances of that? That would be something that you could ask and really be informed about going in. The last type of laser that I will talk about for atrophic scars is the non-ablative laser skin remodeling lasers. These are special types of Indi-YAG lasers that emit at 1320 nanometers, or one called the diode laser. And this actually requires more treatments than the CO2 and YAG laser that I mentioned previously, but has far less downtime. Okay, it is much easier to hack on the part of the individual going through the procedure. It generally requires 3 consecutive monthly laser treatments. And then you see the greatest kind of improvement in the scar, the atrophic scar, sometime around 3 to 6 months after the last laser treatment that you had. And this type of laser can get you to, in studies has shown to get most people to at least 40 to 50% improvement in the appearance of the atrophic scars, and their overall happiness with the appearance can really improve the look of the scar substantially. Most common side effect with this type of laser is just some mild and transient redness that occurs. This typically resolves within about 24 hours. There can be blistering and crusting, and sometimes scars can form, although that is rare. Post-inflammatory hyperpigmentation is still a risk with this laser, but it is much less than with the CO2 erbium YAG laser that I mentioned before, but these non-ablative lasers can still cause that. So if you're a darker skin type, also be aware of that. You're not out of the woods with the PI, the post-inflammatory hyperpigmentation risk with this, but the risk of it is reduced in comparison to those other lasers. So that's everything as far as the different types of lasers for the different types of scars. Do know that lasers can really substantially improve the look of the scar, but hopefully this video was helpful in giving you some baseline understanding that The success of the procedure is going to be operator dependent, and it's going to be influenced by your skin tone and the type of scar that you have, the location of the scar, the coloration, location of the body, any prior treatments that you have. And I think for you, as somebody considering this, considering talking about it with your healthcare provider, kind of figure out what it is for you that you want to achieve. Is it improvement in height of the scar? Is it improvement in color of the scar? Is it improvement in just kind of sensation? Does the scar itch? And that's really the thing that you want to get rid of. Sometimes scars can be very itchy. Does it tingle? Is it in an area that is making things uncomfortable for you? Is it tight? Is that what you want to improve? You can kind of gauge that before going in and really have a good consultation visit before proceeding with any treatment. So I hope this video was helpful to you guys. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe.